think AI belongs in boardrooms or tech campuses. But what happens when you apply it to a rural health center in Cameroon, operated from thousands of miles away in North America? That's not a theoretical question. It's a system I have built. Hi, I'm Marie-Ange Noué. I am an executive medical affairs leader and senior director who specializes in AI-enabled medical engagement and scientific communications. In a matter of days, I designed Applignable, a fully integrated AI-enabled platform with 16 modules that tracks in real time the end-to-end operations of a rural health center, patients, consultations, pharmacy, maternity, lab, billing, surgeries, home visits, and even transport. It allows me to maintain true operational oversight across continents. And what this experience reinforced for me is that AI is not about technology first. It's about designing for reality. First, design for the gap, not the ideal condition. The biggest mistake in remote health operations is designing for perfect connectivity and perfect data. Rural environments do not offer that. So we built for intermittent access, variable data quality, and local teams with different levels of technical fluency. AI only works when it's grounded in the constraints of the environment, not the conditions we wish existed. Second, automate the monitoring, not the decision-making. Our system continuously tracks operational metrics, generates alerts, and flags anomalies in real time. That intelligence is routed to the right individuals, whether the chief nurse, local staff nurses, or lab tech on the ground, the surgeon who comes weekly, the driver who operates the motor ambulance, or Niaban Foundation leadership reviewing remotely. But decision-making remains human. Context matters. Judgment matters. Accountability matters. AI does not replace that. It enhances the ability to act faster and more effectively. Third, build governance around the technology. In healthcare, technology without governance creates risk. We establish clear structures, who receives alerts, who acts, and how outcomes are documented and fed back into the system. The same discipline I have applied in building compliant, AI-enabled scientific engagement ecosystems in pharma is translated directly into this model. When governance is clear, technology becomes reliable. Without it, even the most advanced AI becomes noise. Today, this system supports not only clinical operations, but also community access. Through Niaban Moto Secours, a motorcycle-based ambulance capable of reaching areas inaccessible to traditional vehicles, and Niaban Roam, a community transport initiative both coordinated through the platform. This is what AI makes possible when it's applied with intent, not just efficiency. Reach, continuity, and equity of care. Innovation is not where resources are abundant. It is where constraints force clarity. The ability to oversee health operations remotely is no longer a future concept. It's an executable model. And the principles are transferable, designed for real-world constraints, automate intelligence, not judgment, and build governance to sustain trust. Whether in a rural health center or a global pharma organization, the question is the same. Are we using AI to generate activity or to enable meaningful, measurable impact?